I am Bandon Roth, and I'm a student nurse, and today we are going to do an intradermal injection of Mantoux, 0.1 milliliters. We have our physician's orders here. Those orders were transferred in by Carl Freeman, student nurse, into our medication administration record, which is our MAR. And the important thing when we are administering to a patient is there's 6 patient rights. Our right patient, our right drug, the right route, the right time, the right documentation, and the right dose, which we have at 0.1 milliliters. So now that we have verified that, we're also going to check for patients' allergies, and our patient's only allergy is Celebrex. So now we are going to prepare for the injection. We are using a measured syringe that are in 10th milliliters. Our order is for 0.1. First thing we're going to do though is check for any cracks on our vial, and if it were a mixed medication to inject, we would roll it through our hands, twist it around, and just gently mix it together. We would then pop the lid off. We're going to draw up 0.1 amount of air, and we're going to put that into our vial to make removing the liquid easier. We're now going to pull back vigorously and get a 0.1 dose. We're going to tap it. We're going to turn the vial back over. The tapping is to get the air bubbles out, and we're going to pull it out. Now, because I'm not in the patient's room, or he's not in front of me at the moment, we are going to recap this safely. So it's been recapped. We're going to make sure everything's on tight without touching the top. Our patient is Skip Rocker. So now we are going to take the medication with us, and we're going to go into Skip's room. I'm going to enter the room. I'm going to knock on the door, and I'm going to say, Skip, my name is Bandon Roth. I'm a student nurse, and I'll be administering this Mantoux injection. I will then ask him for a 2-patient identifier, in which he will return that he is Skip Rocker and his date of birth. I will now wash my hands, dry them, and put on new gloves. Again, I'm going to verify that it's 0.1. I'm going to take a sterile alcohol swab, and I'm going to ask Skip for his forearm underneath here, and I'm going to clean starting in the center in a circular motion, working my way out. We're going to allow for the skin to dry. We're then going to uncap our needle. I'm going to pull on his skin slightly, and at a 5 to 15 degree angle with the bevel up, I'm going to insert just underneath the skin to where you can still see, and I am going to slowly inject. And I will pull out, and normally you would see a bleb right here of where the injection is. Now, I'm not going to put a Band-Aid on or wipe with pressure, but I am going to blob any blood or medication that may have come out. At this point, I'm going to take a pen or a Sharpie, and I am going to draw a circle around where the injection was. And the reason is because in 48 hours, we're going to have Skip come back and have that checked by a doctor or provider to see how that has held up after 14 hours and 48 hours, and if that is gone. At this point, I am going to, because I'm close to a sharps container, I'm going to take my syringe and place it in the sharps container. Now, the last right is to document my orders. I'm going to document that it was given with my initials. I'm going to initial here, and then I'm going to sign with my student nurse title, and the date's 2/13/19. Thank you.